So how does the practice of physical therapy integrate with the practice of telerehabilitation? Or maybe our question should be, can a physical therapist change their current treatment style and obtain the same outcomes through telerehabilitation? Physical therapy is the treatment of disease, injury, or disability by both physical and mechanical means. This could include massage, modalities, and exercise. According to the National Association, there are more than 204,000 physical therapists licensed in the United States. Telerehab is the delivery of rehab services over telecommunication networks and the internet, and this would include the practice of physical therapy. Even though telemedicine has been discussed for many years, it is still considered a very new way to deliver medical care. And there is very little research regarding physical therapy and telehealth due to this being such a new and emerging practice over the area of therapy. Plus, therapy tends to follow with their research based on reimbursement. And right now, there's minimal reimbursement related to this type of practice at this time. However, it is predicted in a study by IHS Technology that by the year 2018, the use of telehealth will be more than 10 times that of the 2012 rate. A systematic review was completed regarding telerehabilitation. Out of 477 articles reviewed, only 10 articles were considered to meet the quality standards as outlined in the research. The research found that telerehab is as effective as usual care in populations such as spinal cord injury patients who may be suffering from mental health, chronic conditions, and some cardiorespiratory conditions. But more research is really needed for other conditions, such as how do you take care of someone with a stroke or an orthopedic injury. Research also is needed to determine if this is really a cost-effective approach for delivering therapy. The concern that I have is that most of our current research is focused on the replication or comparison of what we call usual therapy rather than on innovation or new practice ideas within telerehabilitation. When I speak with practicing therapists, the concern that they often tell me and that I hear about, how do we move to telerehab, is how are we going to manage the personal side of therapy? For example, how do you take the personal touch of therapy and obtain the same outcomes with a computer? Think about the power of touch for a minute. As children, a mother's touch may signify security to a child. A couple in a movie theater may hold hands or rub the back of the neck, and that touch signifies affection. Or a woman deliberately bumps into someone in a crowded subway, and the message is clear by the touch: make room for me. Multiple research in healthcare has demonstrated how touch can help the healing process. If you have ever been hospitalized or you have had a family member in a medical crisis, you understand the power of a hug. If you have ever had an athletic injury and you required someone to help you with stretching, such as in the ankle, then you understand how therapists utilize the power of the body or hands to manipulate a joint. Just as in this picture with Chris, he is using the power of a belt around his waist to provide leverage and also keep his hands free as he stretches and manipulates the lower extremity, so that hopefully to reduce pain and increase function in the patient. As therapists, we take pride in our ability to develop a rapport with a patient, and we also take pride in our bedside manner. We have to be the educator. We have to be the cheerleader for our patients. Each time we work with a patient, we consider every clinical factor, including physical deficits, sensory deficits, or cognitive deficits. And we also have to consider the ethical factors, such as privacy and the patient's personal wish and desire or outcome for their medical care. It is really difficult to understand how we are going to be able to obtain the same outcome with our patients if this interaction does not occur. This seems to be the fear that I hear from colleagues. So how do we go from this to this? Basically, we need to be innovative, and we need to be creative in our service delivery for at least some of our patients. And we need to progress the usage of telerehab. Otherwise, our profession will be overlooked in this age of technology. Currently, in the 114th Congress, I am aware of at least 8 major pieces of legislation and bills that are focusing on telehealth. Even here in Iowa, I assisted with the drafting of tele-rehab legislations for both the physical therapy and the occupational therapy professions. To be successful in this change, to reduce our fears, we need to be open to discovery, and we have to have a focus on redesigning care. But we also need to be mindful of the importance of the human and ethical factors. And most importantly, we need to be bold and visionary. Then we can work hand to hand with technology to achieve the best outcome for our patients. Thank you.